My talk is on, is it too late to learn new skills? As Abhijit just told, it's relatively easy surgery, an average surgeon can do it. And I, being an average surgeon, I thought it's time for me to learn something new. Is age a deterrent to learn? I'm Ajoy Shetty from Ganga Hospital, Coimbatore. Usually, if you see 20 years ago, when I finished, around 20 years ago, if you ask anybody who has finished their training what they would like to master, they would say deformity. And over a period of time, in the last 10 years, they would say it's MIS surgeries in the form of tubular surgeries. And there is an interest of learning OLIF and ALIFs in the current scenario. But if you have seen yesterday and the day before, what majority of the people would like to learn is probably endoscopy than anything else. And if you look at the Becker's review, it's online from US, the interest is significantly more with regards to the interest in learning endoscopy. And you look at the publication trends as per endoscopy is concerned in the last few years, there is a phenomenal increase of literature with regards to the endoscopy in spinal surgery. And therefore, that's what's the question, as why I need to adopt. I mean, at my age, why it's important for me to adopt. It's basically a change of environment. There is an advancement of technology. The technology is changing, and it's important for me to be in terms with the changing trends. And there is a demand. People are now used to scopes. The first common question a patient asks, irrespective of whether you are doing a deformity or a cervical or a lumbar spine, is whether you would be using scopy. Patients have got an increased awareness, and therefore they know it is now available, and they demand that you should do it under a procedure, or probably you might lose a client or a patient if you are not able to deliver it so. Therefore, why to learn? A junior surgeon, it is a necessity, early recognition. A junior surgeon who is well versed with endoscopy can establish his practice much faster than his colleague who is not well learned with a minimally invasive approach. It helps in promotion. But what about a senior surgeon as somebody like me? It is important to learn because I have to be relevant with changing times, to stay current in the field, and it's also important to improve the patient outcome. Therefore, the joy and transformative power of a lifelong learning is also something that is important for us, that we have to keep learning throughout our period of practice. As you can see, a child, if you ask a child to do something, they learn it very, very easily, very fast. They're not hesitant to learn. On the other hand, it is not applicable to us. As you age, it's definitely something different. And they have got open minds. They've got fewer worries about mistake. Because there is a brain plasticity, there is the ability to learn, which is quite higher up to the age of 20 years. And therefore, they've got a very, very, like you take the younger surgeons here, they adopt one of my colleagues, Dr. Swapnil, who just finished with us. Within the first 6 months of into his practice, is very well versed in doing endoscopic surgeries. Therefore, there are certain things that comes with age. When we are in our teens, there is the processing speed increases. In our early 20s, the short-term memory for names, and in our 30s, the short-term memory for faces. What do we get when we are at 50s? We have got the verbal ability, the ability to speak. Probably, people here in the audience would have seen me speak 20 years ago and how I speak. Therefore, your ability to speak definitely improves with age. You develop empathy. You have much more empathy, especially men have probably developed empathy later in their life and compared to women who are basically much more empathetic. We are also, on the other hand, we are being content. Therefore, that's again a drawback for us to learn new things. We are content with what we have. Therefore, it becomes a difficult thing for us to learn something new. And this is a video of Pramod doing an endoscopic discectomy. When I first watched Pramod do an endoscopic procedure, the ease, the fluidity, and the comfort at which the procedure was being performed, it was stimulating, and I always thought whether it's possible for me to learn something new. I'm not a good learner. I'm an average surgeon. It takes me a lot of time to adapt to something that is new. Therefore, can we learn at 50s? Can we learn new skill? Yes, we can. It's easy for us to learn facts. It's easy for us to read and understand things. It's definitely easier as you grow older, because it's probably your capability to adapt, to learn is better. But to learn new skill is relatively difficult, but we can learn. We can learn throughout our adult life. The most important thing is apprehension, whether we'll be able to do it, what about the difficulties, what about the problems we try to face. It needs more time and effort, it needs a growth mindset and also an environment wherever you are working, an environment should be supportive for you to learn new things. We always tend to overthink, often think through the new skill in great detail before trying it, and at a particular stage of your career, being advertising is sometimes difficult. We have something that is a gold standard. I am used to doing a microdiscectomy, and I would prefer that when I do my first endoscopic discectomy, the result to be as good as the microdiscectomy which I have been doing for over 20 years. And that's where the question comes of learning new things. And we are empathetic. In the beginning of my career, if I do a mistake, I am worried what my colleagues will think, what the patients will think, what the people around will think about it. I'll be more comfortable hiding the fact that I did a mistake. But now if I do a mistake, I'm not bothered what the other person will think. I'm bothered about how it is going to affect the patient family. Therefore, you are very hesitant to try something new on a patient when you are not exactly sure whether you are able to deliver that amount of results. Therefore, you are worried about complications. Finding time is again a biggest challenge. The most difficult psychological hurdle is to overcome the fear of looking dumb. Like if I am here today and to say that I am learning an endoscope with a friend of all juniors who are quite well versed in doing that, it's like I have to overcome the fear that I am looking dumb in front of a guy who is 25 years or 30 years junior to me and who is well versed in doing a technique which is now a necessity for me to learn. But it's important for us to relax, empty the mind, and get into the groove. How to do it? Continuing education is real. We have to be open-minded, looking for ways to optimize the outcome, and it's important to take personal time away. Learn or train with other surgeons. You can have surgery visitation. There have been a paper which I looked at strategies for new skill acquisition by practicing surgeons. It's basically a general surgical paper. There is a wide variety of methods. This is a survey of 150 surgeons. Most of them attend workshops like how it was there on the day one. People with scrubbing cases performed by another surgeon, a self-directed study, are performing cases under supervision. Therefore, what is important is to adopt multiple options of this. Attend workshop, assist a surgeon in the process so that you can get well versed before you try into your practice. A structured introduction of new procedures is important. It's important for us to keep learning. It's important for us to change with time. My journey, I would like to thank Pramod for being a guide to me in this aspect. And I've done around 100 cases so far. And we have done a study of 100 cases versus endoscopic and microscopic discectomy, a propensity match study. As you are well aware, there has been a significant improvement in the first 3 months, but at the end of 1 year, there is no significant difference between the group. But what is interesting for me is probably the fact that there was a significant incidence of numbness in the patient for whom I have done an endoscopic discectomy, that is basically an intralaminar discectomy. That is probably because of my learning part of the curve or probably because of more retraction, I'm not exactly sure, but it is present in the literature. To conclude, yes, age is a deterrent. Yes, it is possible to learn, but it needs a lot of effort, time to learn, persistent surgeon visitation, and acquiring new skill is always a joy. The joy and embarrassment of being a novice could be an antidote to the strain of being a perfectionist. It's not necessary that as we age, we need not learn new things. If you had seen this particular movie of Maverick, you realize that when Tom Cruise is being brought back into the program, he thinks that he is coming to fly. I don't know how many of you, we grew up with this particular movie, therefore I had the pleasure of watching it as the new movie is. Therefore, it need not mean that as we age, we have to stop learning. It's important that we have to keep learning. Can I have the volume?
I'm not sure who I trust to fly the other three, but I'll find a way to make it work.
I think you misunderstand, Captain.
Sir?
We don't want you to fly it. We want you to teach it.
But I still want to fly. Thank you.
Teach it.